It will be very
I,
different.
I say sometimes to people when you speak about these things, and I always end it by saying, I hope Gert is wrong.
Hmm.
Do you hope you are wrong?
Of course, Philippe. I hope I'm wrong, and I'm just. I hope a quiet, a normal human being. So in my spare time, or when I spend time with friends and family, and I forget about the science, which is very difficult for me, then also I'm all of a sudden overwhelmed by this feeling of surrealism that I think, oh, come on, this cannot be. This cannot be. But when I then dive back in the science, it's exactly the other way around. And I'm saying, come on, I've done really a very thorough homework. I've exposed myself to so many questions, to so many criticism. I've not left any stone unturned, very honestly. I mean, this has taken an awful amount of my time, of my energy. So the likelihood, unfortunately, the likelihood that I will be wrong is, in my opinion, very, very remote. Of course, I could be wrong with regard to the timeline, but even there, I really think we are coming very close. When you say end of June, when you say July, summer vacation, or when you say tomorrow, this is all within a very narrow time frame, right? I mean, this is all within 1, 2, 3 months, let's say. Um, but that this is just spontaneously going to go away. I mean, that would be completely against any law of evolutionary biology and against the combined laws of immunology and virology, right? And that is also what we are seeing. And yeah.
Yeah, I think it's a similar thing, is that I think about it from a clinical point of view, is that even within the clinical community, people have moved on from COVID.
Sure.
The way how I look at it is a perspective of risk mitigation. So in the same way, I wouldn't ignore a bird flu discussion. I wouldn't say it's impossible. I would think about it, reflect on it, and consider, if it did happen, how would we approach it? That's risk mitigation. For the powers that be, and that means both in the public health, political point of view, and a clinical point of view, to not have a risk mitigation strategy or approach, whether or not they thought it was right, but to just say, okay, if we saw something, or if we thought, is there anything we can do to mitigate it? I
Yeah.
agree with you. To have people not doing that
Yeah.
is unforgivable.
Yeah, and that is also why I'm saying that society will be completely taken by surprise, because not only, as you pointed out correctly, has it been become much more difficult for laymen to believe that this pandemic is still ongoing, because they base their evaluation, of course, on hospitalizations, on cases about which they hear of severe disease and etc. And there is, that has calmed down. But the fact that on top the public health authorities and experts are hiding this or trying to make people believe that there is herd immunity, that the virus is transitioning to endemicity, etc., adds, of course, to this unawareness of the broader public that it is not finished. If it were only that, what they were communicating, we would already be very happy that they were saying, listen, it's not over. They're saying, okay, it's not completely over, but since the beginning of this year, symptoms have come down, levels in wastewater have come down, so there's no reason to believe that there will be flare-ups again. So that is what I'm saying. So don't worry, because we are following it, we are doing surveillance, we are tracking it, etc. As if that were a plan B. There is no plan B. There is no awareness of the population. So in fact, what they are doing, that was the conclusion of the article that I just wrote, is that in fact they are adding to the surprise that will occur for most people when all of a sudden we will see this flare up, of course, right?
As we come to the end now, Gert,
Yeah.
this interestingly could be the last session that we have before your prediction could come through? Because if it does come, we usually talk every 3 or 4 months. And so we're now the end of May. So the next time we talk may be about close to September. What would be your final words if, as you anticipate that transition?
Well, my final words would be, both for the vaccinated and the unvaccinated, is to be prepared. And frankly speaking, that's also what I'm doing. And, it's not like, for me, this is a lot of fun, sharing all this, making people afraid, etc. No, I'm preparing myself. The unvaccinated, I've said this multiple times, don't need to worry. Of course, they need to make sure they stay in good health and they take care of their health, of their lifestyle, of their body. That is still important because, even if you have a trained innate immune system, but it's not in a healthy state, it won't help. But then the important point is also that you need to be prepared to a period of chaos. Because what will happen most likely is that the healthcare system will collapse. When the healthcare system collapses, I mean, this has all kinds of repercussions, societal chaos, etc. So we need to be prepared to that. And the vaccinated, I'm insisting, I said this last time, please make sure that as soon as you see that this crisis starts in one or another country, immediately take them in a prophylactic way, so in a preventive way, antivirals. And of course, as I'm not a medical doctor, I cannot advise or recommend this. But if I were vaccinated, I've also put this in writing, I would seriously consider getting myself vaccinated with a measles or a mumps vaccine or both, an MMR vaccine, just to stimulate the innate immune system. As I was saying, can we do this? The innate immune system is not negatively impacted in the unvaccinated, just that it is not trained. So how can you train it still without, deleterious effects? I think that is an option. That together with the antivirals and being prepared to a period which I think will be pretty short, but of kind of very substantial chaos that we will see in society. That is at least what I'm preparing for, and that would be my last words. It's not a lot, but what can we as poor human beings do to still counter a transformation that nature is now obliged to implement in order to restore an ecosystem that has been profoundly disturbed, right?
Yeah,
We
that's
will, we will primarily have to watch from the sideline.
yeah. I think those are profound words, and as I reflect on it, is that nature has the responsibility to protect the rest of ecosystems
Yeah.
from ongoing circulation, and therefore you are probably right. The only way this can be achieved is through only those who have the capacity for herd immunity would remain. That is pretty serious, pretty significant. And you're right, from a scientific point of view, and from I guess human, not human, but evolutionary perspective, with all mammals and all animals, that would probably be the best outcome for all.
Yes, and by very last conclusion, I'm 200% certain that if that happens, the panzootic will also end immediately, right?
Yeah,
Because of these relationships and these mutable, interactions that one disturbance, sustains the disturbance of another ecosystem. But it can be immunologically explained, or at least be made plausible, and that's why I wrote the article. Just that people don't think it's all philosophy. This is not science. Yeah.
great. Thank you again, Gert. And we will speak again. Hopefully, the next time we speak, I can say to you, listen, Gert, don't worry. It's all done. Nothing happened. You were so wrong. But
Yeah,
yes, I think we
I very
should.
much hope that would be the case, Philippe. You know that.
Yes. So just
Yeah.
wait with me, Gert, while I do the outro. Thank you, everyone, for watching. Have a great evening.
Okay.